Talking Therapies service offers short-term, solution-focused, one-to-one counselling. By short-term we mean normally somewhere between 6 and 12 weeks. So you'd see a counsellor on a weekly basis for about 50 minutes every week. We offer a range of different trained counsellors offering different modalities with what we call it, different approaches in terms of counselling. So we offer counsellors who are trained in CBT, offers counsellors who are trained in psychodynamic, so a range of different modalities depending on the need.
We offer support for people with a wide variety of issues, mainly people with anxiety and depression, but we also help people with issues relating to anger, bereavement, relationship issues, that kind of thing.
And it's very solution focused, so a client will come to us after assessment and they will have a clear, from themselves, they'll have a clear idea of what they want to achieve out of counselling with us. So it'll be a very clearly defined goal that gets reviewed on a week-by-week basis within the therapy with the counsellor. We're what we call an integrative service, and that makes us a bit different from the other kind of competitors or other local counselling providers. And what that means is that we have a range of different counsellors that are trained in different approaches in counselling. So they've gone on different trainings or on different training courses, and so offer a different sort of therapy intervention.
We try to offer what is the most effective form of counselling, but also we give anyone who comes into the service the choice of what they might be looking for, and we'll try and give you as much help and support in deciding the best treatment for you. That
is really one of the best things that this service offers. It's a real flavour and a real kind of diversity in terms of the type of counselling that you can get compared to other local providers.
Somebody who comes for counselling, I think they have to expect they're going to be offered a secure space and a confidential space that they can share their problems and difficulties with someone who is a trained counsellor, so is trained to have the right listening skills and also a non-judgmental response to everything they say, but also very neutral in what they're saying. Somebody who can give the right encouragement for people to move forward and take charge in their lives. Counselling can support them and help them to move forward, but also they have, to be aware of what they want to achieve and be ready for it in some way. I would say that counselling can only have benefits, can only provide benefits for somebody. It provides that secure space for somebody that can build up on their trust and start opening up about and share their problems. It definitely can support somebody to gain self-awareness, build up on their relationship skills, and in general, have a better understanding of the world around them and how they fit in this world.
The kind of things that we can offer are referrals for more long-term counselling on a local basis. We can offer internal signposting, so we have community befriending service, we have an art therapy service internally. We can also refer people around kind of advice and benefits. We have a citizen advice bureau service that comes in and does drop-in sessions. We have a health trainer that's based here twice a week that we can refer directly to. So it really depends on whether it's a physical health need or an additional mental health need. You can refer people to a lot of different services and organisations depending on their need, really. I think being in Central London and being a voluntary sector organisation, we're really well placed to make sure people are really linked into the post-care. So once they finish therapy with us, they're not just left in the middle of nowhere. We can refer them to other places depending on other needs that have come up during the course of therapy.
We treat each person who comes into the service as an individual, and we see each person and their presenting issues as unique to them. And so when you come into our service, you will be met by one of our assessment team who will try and find out as much information from you as possible about what is going on for you in order that we can then help to decide the best treatment for you.
The counselling service that we deliver around mother tongue, which works with people with Arabic and Farsi communities, delivering counselling to those communities. We've just won an award. Just found out just yesterday. In fact, we won an award from Westminster Council, which kind of tells us that we're a good service in that sense, I hope. You've just got a really well-trained, hopefully well-supported, professional outfit that really cares about making a difference, and we give them the infrastructure and the support and the resources to do the very best they can.
You can access the service in a number of ways. You can go to your GP and ask for a referral, or if you go to our website, you can fill in a self-referral form, and then we'll contact you within a week to arrange an assessment.
People who actually come with an idea or a goal of what they want to achieve through counselling, has been shown that they are the ones who can benefit more of a short-term intervention. I mean, I know sometimes it's very difficult to come and know exactly what you want, especially if you have never been into counselling, but because it's such a small amount of sessions, just coming with an idea of what you really want to achieve, I think it's going to be very helpful for somebody to get the benefits out of counselling.
It's really, really important to the service and to everybody that we protect people's information and confidentiality.
Anything you say in counselling is confidential. It's essential for the counselling process to feel that you can trust the person that you're with. And so, of course, we wouldn't share any data or any information with anyone else without your permission. The only time where we might have to break confidentiality is if we feel you're at risk. So in order to keep you safe, we would need to let someone know, be it your doctor, or in extreme cases anyone, so something maybe taking it further than that. But other than that, all your information is kept within the service in a secure database, and if anyone were to contact us to ask for your information, we would only release that with your written permission. We are a service that's set up to help people with common mental health difficulties, and we try to use what is the most clinically effective treatment options to help you to feel better. It's
to try and give people a window and an opportunity to talk about things in an environment that they don't have elsewhere. It's to talk to someone in a really safe, secure place where they can shed light on things and explore maybe often painful things with a trained professional and work through some of those things, get a better idea of themselves, get a better idea of some of the issues they're working through, and hopefully gain better tools and better insight into how to manage them long term. We're not here to cure people, it's to help people get more educated and a better understanding of who they are, how they feel, and hopefully where they want to be. I think it's also about self-managing and helping people better manage their mental health. We get a lot of people that come through that really, obviously unhappy and distressed and anxious about being in counselling. But I think it's making it clear to them as well that anyone can go through those issues that they're going through, and that they've done the right thing in trying to access support and reach out to someone and talk to someone.
The service is for people over the age of 18 who live in the Borough of Westminster or who have a GP in Westminster. It's a free service, so we wouldn't ask you to pay, and anything from 18 to, I think we've had someone in the service who was 92. So we help everyone who we can.